everyone, I'm Dr. Colombo. Today I wanted to talk about, you know, wrinkles or lines. So when in dermatology we think about lines, we think about two types of lines. Lines of expression. So those are lines caused by moving your face, such as like frown lines, smile lines, moving your eyebrows, chin. So those are what we call lines of motion. And of course, you also have your static lines. Lines, they're just kind of like stuck on the skin and happen from aging, loss of collagen and elastin over time. There are multiple things you can do for both kinds of lines. So for the lines of motion, the go-to is to, of course, slow down or stop the motion. And we achieve that with injectable neurotoxins. The brand names that people are familiar with are things like Botox, Dysport, Zeman. So you inject those agents in muscles that you want to slow down, and then by not moving those muscles as much, the lines, fade or disappear altogether. Botox injections are very safe, very painless. The results typically appear in, I would say like 3 to 5 days. A little bit quicker for Dysport, maybe 1 to 3 days you start seeing results, full results in 2 weeks. Both products will last about 4 months. I do think that Dysport will have slightly more longevity than Botox. And they're great agents to address lines of motions. Areas that we typically treat with Botox are glabella, so those are your 11s or frown lines. Forehead, keep in mind that by treating the forehead, you're treating a muscle that elevates the brow, so you have to be very cautious not to depress the brows by trying to get rid of all your forehead wrinkles. The other area that we treat are the crow's feet. We treat lines on the nose called bunny lines, lines around the lips, chin, dimples. We also treat the muscle on the side here called DAO, which controls, depression of the corner of the lips to keep the corners elevated. And we even treat your chewing muscles or masseters in people that have, a jaw clenching issue, or very enlarged, lateral, chin, lateral jaw area. So great treatment for lines of motion. At Skin Tap, we have a network of aesthetic dermatology doctors that we can refer you to that can definitely, maintain your Botox. I also initially talked about the static lines, just the lines that happen from aging and loss of collagen and elastin. Those lines we address with number one, a topical retinoid, which can really lessen the lines. The effect of that is very slow, so you slowly over time see benefit in those. If you want faster improvement, lasers, microneedling, especially microneedling with radio frequency, are pretty effective. Of the lasers, the ones I like for fine lines are specifically the fractional ablative ones, such as the erbium and the CO2. They're great for that. They ablate top layers of skin and with that significantly decrease wrinkles. Non-ablative lasers can also be helpful by inducing collagen. Same principle with microneedling with radio frequency. You induce collagen and with that you have some textural improvement. So again, we at Skin Tap have a network of doctors that we can refer you to if you're interested in any of these procedures. But come see us so we can evaluate your face and give you a professional opinion on what may benefit you the most. Take care.